Welcome to another episode of The Blend, a podcast brought to you by the Journal of the Dermatology Nurse Practitioners and Physician Assistants. In this episode, Dr. Apple Bodemer, a dermatologist at the University of Wisconsin, shares the botanicals and supplements that she commonly recommends to patients with hair loss, with host Dr. Sonal Choudhary. She also discusses other integrative approaches to treating hair loss, including acupuncture, hypnosis, and red light therapy.
Hello, everyone, and thank you for joining the Blend podcast. Welcome to all of our advanced practice providers, physician assistants, nurse practitioners, and physicians in dermatology, and any other specialties who want to learn more about integrative dermatology. We really hope that we're able to provide some unique insights about what is up and coming in integrative dermatology. Please walk us through some of your top botanicals and supplements. We talked about, vitamin Ds and some biotin stuff, but things that we didn't go into, rosemary oil comes to mind, and some of the other common things that we go for. Sometimes I talk about omega-3s. There are some already available supplements on the market. I'm going to say Nutrafol is one of the top ones for that. How are you bringing that into your discussions, or people asking you about it, or do you suggest it? And, how does that go? And even before you get into it, I'll say that I really have now started to recognize that having at least one supplement conversation with the patient makes the direction of our approach in a place where they feel more, heard, integrated. So I try to bring that up for them. But what is your approach, and what are the top things that you use if you have 5, 6 of them?
Yeah, I think it builds trust when they realize that you do know what you're talking about and that you're willing to bring up a supplement. As a physician, they expect us to be pushing drugs, which isn't fair. I think there's so many physicians who don't do that, but the way that we're portrayed in the media and in culture, and especially now with the influencers who are out there with nothing to lose, they can say whatever they want. Some of them have good information and some of them don't, but as a physician, if I get out there and start saying things that are not founded, I could lose my license, so we're sort of battling this just glut of information, and patients are trying to navigate and just people, not just people are trying to navigate what's real and what's not. I agree with you. Nutrafol is really the Cadillac when it comes to supplements. It is on the pricier side, but it is a great investment because it does contain a lot of botanicals that are really helpful for a variety of different types of hair loss. And if you start kind of parsing out and saying, okay, I want to give you an adaptogen, and I want to give you, good quality multivitamin, and I want to give you this, sometimes we're ending up at the same price point anyway. And so helping patients see like what their overall cost might be, and can we peel away some of the other things that they might be taking if we're going to go with one of these Cadillac kind of supplements, can be helpful to help them kind of come to understand and accept the benefit. They do a lot of research behind what they do. And what they put out on the market. It's really remarkable. And I think they've set the bar high for other companies to do the same. I think depending on the type of hair loss, I love pumpkin seed oil. Pumpkin seed oil is something that I talk to all of my hair loss patients about. It is a botanical 5-alpha reductase inhibitor. And so the data that we have is limited. It's tricky because, it used to be that the NIH was really robust and there was tons of funding to do all kinds of studies. Now that's shifted a lot, and a lot of the onus for paying for research is really on the companies, and supplement companies tend to have a lot less kind of R&D type money than other bigger pharmaceuticals. So I think we just in general in integrative medicine, we have to recognize that, look at the data that we do have and extrapolate what we have, and also pair that with what we know is safe. And I know that pumpkin seed oil is 100% safe. I have no concerns. I don't want people drinking shot glasses of it, but in taking the doses that are recommended for hair loss, that it can add to what they're already doing. And so I have a smart phrase that I kind of blow in, and this is one of the ways that we can make this very quick and very time effective, is to use these handouts or smart phrases, whatever your medical record system allows you to do. And then you can just blow it in, and you've got dosing. And I have a couple brand recommendations, so easy for people to buy that on Amazon or even in grocery stores. So pumpkin seed oil is one that I'll generally recommend for most types of hair loss, but it's especially been effective and looked at in in alopecia, androgenic alopecia. The rosemary oil improves blood flow. It's also a 5-alpha reductase inhibitor. When I talk about that takes testosterone and converts it to dihydrotestosterone, or DHT, which is a much more potent activator of the androgen receptors. And that enzyme is on the hair follicles and the receptors on the hair follicles. So we get this local, really intense androgenetic drive on the hair follicles, which leads to miniaturization, which kind of leads to the downstream leads to the genetic pattern thinning. And so these blockers and finasteride and dutasteride, that's the way that they're working. They block that 5-alpha reductase enzyme. These botanicals do the same thing. They're just gentler. We don't see the same side effect profile that we can see with these other pharmaceutical 5-alpha reductase inhibitors. So pumpkin seed oil is a big common one that I recommend. Rosemary oil, that's not something that you would take orally, but you would use topically. It's also been shown to improve blood flow on the scalp. There is a blend, and this is one of my favorite little DIY things to give to patients who have alopecia areata in particular. And it's a blend of lavender oil, essential oils, and you want to use high quality essential oils so that it's not diffuser grade essential oils, because essential oils can be dangerous if you're using low quality. They can have more protein in them and can cause problems with contact sensitization and development of allergy towards them. But if they're high quality, there really shouldn't be much protein in them, and that risk is much, much lower. So lavender essential oil, rosemary essential oil, cedarwood essential oil, and thyme essential oil, and that's mixed in a combination. The studies have been done mixed in a combination of jojoba oil and grapeseed oil. So, and that's something that can be massaged into the scalp. It's, again, I don't think alone it's going to clear up especially severe alopecia areata, but for small patches of localized alopecia areata, which, they're going to go away on their own anyway, even if we don't do steroid injections. But if we do steroid injections, we want them massaging that anyway, and giving them something that they can do is really helpful. And that rosemary oil is going to help improve blood flow to the scalp, which is kind of something that we want. So that's from a botanical supplement standpoint, I really like that. I think when it comes, this isn't a supplement, but this is an integrative approach that I use for all of my patients with telogen effluvium. I mean, I'm checking the labs and kind of gauging their stress level. But I do teach a lot of my hair loss patients breath work. It's one of my personal favorite things. It's something that's transformed my life and personally. So I have had, I would say, sporadically regular breathwork practice, go through phases in my life where I think most of us are like that. But there's a quick, easy breathwork technique that I've taught to a number of patients. And I even had one person who came back, she had laminated it, given it to all of her family members, and told me that it changed her life. I mean, it was just, and I just breathed with her. So I'm going to teach you this. It's called the 4-7-8 relaxing breath. It's something I learned from Dr. Andrew Weil in my fellowship. He loves this, and he's got a whole audio recording, and I think there's a book associated with it. It used to be a CD that I'd have them get, but nobody has CDs anymore. But you can go to, I think it's on Sounds True, but if you just look it up, breathwork, unlocking the ancient keys to self-healing, that will bring you to audio files that you can download. But it talks about the history behind breathwork. People have been doing breathwork for thousands and thousands of years in Asia and other parts of the world. And it really is, we're already doing it. I call it the gateway to meditation, because it's something that you can do in the moment. A lot of my patients are really busy, especially young parents or people who are trying to get jobs off the ground. A lot of the things that'll cause telogen effluvium. And so I'll get to it. It looks like this. You breathe in, inhale for a count of 4, hold it for a count of 7, 1, 2, 3, 4, 5, 6, 7, and then exhale for 8, 1, 2, 3, 4, 5, 6, 7, 8. Inhale for 4, 1, 2, 3, 4, hold it for 7, exhale for 8. And you can do that about 3 or 4 times. And then you take a deep cleansing breath, which just means a regular breath. And if you're still feeling kind of keyed up, you can do another cycle of that. It's something that takes seconds to do, less than a minute. Or you can kind of do it a few times in a row. And I'll use it in the middle of my busy clinic if I've had a challenging patient or a challenging case where I've kind of, really used my brain in all kinds of ways or feel like uncertain about my diagnosis or whatever it is. My kids, when they were young and they'd be fighting in the car, I'd be at a red light and I'd just be like, so it's something that you can use in every aspect of your life, and it really can be helpful. It's been studied and shown to decrease cortisol levels. It's been studied and shown to calm down the activated parts of the brain through fMRI studies. It's been shown to decrease blood pressure and heart rate, and actually to improve heart rate variability, which is an important heart rate variability. We want a very variable heart rate that gives us an idea of our parasympathetic tone, the rest, relax, and digest part of our nervous system. So that's my pearl for telogen effluvium, along with the labs and kind of the other thing.
And I'm going to interject for just 1 second and say that it's also free. There's another breath work thing which is very, very quick and has exactly the same type of results. It also induces the parasympathetic pathway very fast, and it's called the physiological sigh. Yeah, and in that you basically take an inhalation and then you take a last bit of an extra inhalation. So you almost like suck in a little more air, and then you just like let everything go with your mouth open, like like that. So you do like a and that simple thing can bring all those benefits as well. So you can alternate between different methods, find which one works best for you. And one study that I was holding on to that I wanted to share in the same mind-body sort of context was slightly older. It's from 2006. They had 21 patients in this study with very severe refractory alopecia areata. And 12 of them achieved about 75 to 100% scalp hair regrowth after 3 to 8 hypnotherapy sessions. Some did relapse later, but the trial was also uncontrolled and whatnot. But then there was this, and we know that alopecia areata really is a lot of stress-related things and lifestyle-related things. So, and people can regrow hair without even changing a whole lot. It can happen. So who knows? But there was this study done on it.
Well, and I think, medical hypnosis, people get nervous around that word hypnosis. But medical hypnosis, really all hypnosis is self-hypnosis. And throughout the whole hypnotic process, people are in complete control. There's none of this like levitating and floating around the room and grabbing a knife and stabbing your mom that we see, whatever, like that's just ridiculousness. And I'm lucky to have a couple people who are trained in medical hypnosis, and I would encourage people to look for providers who are trained in medical hypnosis if they're going to go down that route. It's a lot like a guided imagery session. And really, it helps you get into that deeply relaxed state where your body is open to suggestions and where your body is able to share information with you, which I know sounds a little woo-woo and crazy, but there's a really incredible book called The Body Keeps Score by a Dutch physician. I butcher his name, but it's a really powerful, and he's not the only one that's written about this or studied it or looked at it. And there are a number of studies about hypnotherapy and chronic inflammatory skin conditions. They're not all great. They're not all double-blind placebo controlled, but there are a number of reports out there about hypnosis being really useful. And the provider that I work the most closely with, she does a recorded session. So you go in, she's a family medicine doc. Patients, it's covered because it's a visit. She codes by time. She records the session, and then patients go home and listen to it much like they would a guided imagery session. And so it really is a form of interactive meditation, is I think when we really look at what's happening and the impact and effect that is happening with it. I could say a lot about acupuncture. It's not very well studied when it comes specifically to hair loss. But for hormonal regulation, it works really well. And so for my perimenopausal patients or people who are in andropause, which is kind of a term that's being more widely accepted for men, I think they go through similar decreases in shifts in their hormones. I think acupuncture can be great there. It's really good for stress related kind of anything. And so I definitely, it takes, the right person needs to be open to it. And especially with hair loss, with acupuncture, they're looking at energy in a really different way than we look at it in kind of Western traditional practices. But it often takes, with anything skin and hair related, it takes a while to get to that point of rebalance. And as we know with hair in general, it can take 6 months to a year of being on a treatment before we're going to see any benefit because of that issue with the hair cycle. And we're talking about what's going on under the scalp, not just what's going on the surface of the scalp. So that's just something to keep in mind. And then those are the patients that I'll generally recommend, is for hormone balancing, for people who are really keyed up, stress management. And we do have a lot of other tools that can be incredibly useful as well. Lichen planopilaris or frontal fibrosing alopecia, those are kind of this, lichen planopilaris is an umbrella term that covers the frontal fibrosing alopecia. And also there's a more standard form that, at least in our world, when we're taking boards, we learn footprints in the snow, because the frontal fibrosing people will get scarring alopecia across the frontal hairline. It looks like a hairband just went and removed part of their their hair. Their scalp gets tense and firm and shiny, and they might have what we call a lonely hair sign. So, and you don't need a dermatoscope to see it. It's easier to see with a dermatoscope, but you can often see there's this kind of shiny, scarred, bound down scalp, and then boop, a little hair kind of poking up in the middle of it. And why that hair follicle stays active and survives when all of the others fall victim to the inflammation, nobody really quite understands that, at least that I'm aware of. But that is kind of the classic. They're in early in the stage of the disease. That's a lot of inflammation, a lot of itching, burning, pain, redness, especially right around the hair follicles. Their scalp will look like strawberries almost. They'll have little follicles that are plugged. They have perifollicular scale, and then these perifollicular papules or bumps that are bright red with this little white scale on it. And what we want to do is catch it early. When people come to us and it's already burned out, it's too late. That scarring is happening. We're never going to get that. And you can't do hair transplant on that scarred area either, because we've lost the blood supply there too. So that's an important thing to be able to counsel patients on, because people sometimes will come in saying like, I'm going to get a hair transplant. Like, well, I can probably save you $50,000 because it won't work if it's scarred down already. But we want to try to just mitigate and minimize the impact that scarring is going to have and shut it down more quickly. And that's what a lot of our conventional treatments are: immunosuppressant, anti-inflammatory. And that's sort of what we're looking at. In this is a whole other conversation. I use a lot of low dose naltrexone. In fact, that's my first line of defense in terms of my first line of treatment is naltrexone, along with or instead of sometimes Plaquenil, depending on what the patient is open to. And that's, I think there are some podcasts out there talking about it. That's something that I think we could talk specifically about, because there are some nuances to prescribing that, and you do want to make sure you know what you're like, how to prescribe it well. It's not a dangerous medication, but it is off-label. It's an out-of-pocket cost, and there's some tricks to prescribing it. This is where I think red light comes in really, really useful because of that anti-inflammatory benefit of it, and it's something that I really recommend for those patients. A lot of people with lichen planopilaris also have androgenetic alopecia, that genetic pattern thinning, and the red light's going to address both of those. And then really thinking about, we're going to do the drugs because we want to shut this down. Sometimes we're doing intralesional steroids, very, very low concentrations, usually on the scalp for this. If I'm doing it, I don't do it often, but if I do, it's 2.5 milligrams per ml of Kenalog. And I'm not doing it right along the anterior hairline, because you can get tracking of the steroid down the veins in the face, and you can end up with this trough where the vein bumps up, but you get atrophy around it. And so that's something you do want to be really careful of. But for the kind of classic footprints in the snow, or if it's more on top, that's a situation where you might think about that. And so that's a conventional but not as widely used, I think, the steroid injections. And even in my practice, I don't use it a lot. I will focus on anti-inflammatory diet with these folks as well, just really trying to do everything that we can to drop down inflammation. So turmeric is a supplement that I use a lot of, and I think turmeric is our sexy, golden, beautiful anti-inflammatory spice that a lot of people know about. And then the curcumin, I'm of two minds on the curcumin supplements. That's the most bioactive ingredient in turmeric. But personally, I really believe in the whole spice, and because we have a number of other compounds that we don't even know about that are going to act synergistically. And I think when we've run into problems with pharmaceuticals and with supplements in the US, is that more concentrated and higher doses are better. If something is good, then more of it and more concentrated forms of it are better. There's no evidence that curcumin is dangerous at all in any way, shape, or form. It does tend to be expensive, though, and if cost is an issue, sticking with the turmeric can, and you can even make your own capsules by sprinkling a little black pepper or ginger in and putting the powder on, buying empty capsules. And I've got a number of patients that do that. But other anti-inflammatory spices like rosemary, oregano, things that are in most people's pantries right now, even if they don't cook kind of Asian style food, those are really powerful anti-inflammatories too. So if you're making rosemary roasted potatoes, throw in a quarter, instead of a tablespoon, put in a quarter of a cup of the rosemary. And really, in my house, that's what we do a lot of. If it's a spice that you enjoy, go crazy with it. And you're only going to be augmenting the anti-inflammatory benefit by adding more.
So get it more from your food than trying to get it through a capsule, which is ideal. Yeah, and like a lot of times people, they're cooking stuff. A lot of people don't cook nowadays.
Yeah.
Step one is to just get them into that. We actually created a resource document to just teach people what anti-inflammatory diet is, how to do it, etc. And I have found people to have finally embraced the idea that it is doable.
Yeah.
In fact, my biggest success story was when I was able to have there was a student who goes to the university here, was able to change from just buying food to starting to eat actually meals they made in an Instapot and a small slow cooker. I said, just those two things. If you just buy those two things, you can get so much done.
Yeah, you
You don't
can.
have to turn a stove on and you will be eating better. And they did. And they came and told me, okay, fine. It was not that hard, but it is still hard because I still have school and blah, blah, blah. So,
Yeah, one of the tricks that I have, and this is something that we do in my house. I mean, I'm way busier than I want to be most of the time these days, and with teenagers coming and going and sporting event, like, we're there's kind of I'm the only adult in our household, and so I get home from work at 7, and we're kind of going, and I don't have somebody making dinner for them or for us, so I try to batch cook on Sundays. And the other thing is, when you do get takeout, just recognize you're getting a lot more fat and a lot more stuff in it than you would probably do if you're cooking at home. A lot more salt for sure. But so if that is something that you need to lean into, one of the things that I'll do is buy a big head of purple cabbage, chop it up, and I put it in a baggie. And so and then we buy bulk cans of beans from Costco, because ideally I'd be making my own beans, and homemade garbanzo beans are so creamy and delicious. I love them, but we just don't have a lot of time. And so that, I'll buy that, and we open up a can of garbanzo beans, and we grab some purple cabbage, or we'll grab a big bag of broccoli. Costco sells them, but you can also buy them in other places, or just buy the broccoli from wherever you normally get it and chop it up so it's ready to go for the week. And then if we get Thai takeout, instead of just eating the rice with all of the heavy saturated coconut oil, and which is not the worst thing in the world, but lots of it can be, and lots of salt, then we're putting the cabbage and the beans in our thing first, and scooping um the the Thai takeout curry on top of that, and eating that along with some brown rice. And so that's something you can do before your week even starts. And then if you find yourself like needing something quick on the go, my kids will pull that together on their own. And that increases the antioxidant benefit, increases the protein, or having tofu at home that we just cut up and throw in the already made, takeout curry. You're getting a lot more protein, a lot more antioxidants, and that takes even less time. So ideally we're all cooking at home, and we're making amazing, wonderful meals that are nourishing, and we're eating slow together as families. But life is what it is in our current environment, and it's not optimal for that. So we kind of do what we can, and there's some quick, easy things that even if you are eating takeout a lot, you can kind of augment your takeout.
Absolutely. And I just for the listeners to know that Dr. Bodemer is vegan, right? You're vegan. You follow vegan diet. Okay. Yes. And I know I am an absolutely not vegan. So that there's a bit of that clash, and my protein comes from all kinds of other protein sources too. But that's the beauty of it, right? Like you can make your food very well rounded and very nutritious, no matter what. It is doable. And one of the cool things that I learned about was that even the frozen fruits and vegetables have equal amount of nutrition as the fresh ones. In fact, their decay rate is less because they were flash frozen at the site of collection. So having that in the freezer, if you're a smoothie person or a soup person, those work out also really, really well. So this was a very awesome coverage of a really difficult topic. Thank you for making time for this. I appreciate you, and you're going to have to come back.
Well, I appreciate everything that you're doing to kind of move this forward, this whole field of integrative dermatology. You're an amazing provider. I'm so proud to call you an alumni of a program that I helped teach. And, you just kind of are elevating the field in so many ways. So thank you for having me. It was my honor. I hope everybody listening got at least one thing that they could take away and improve their lives and the lives of their patients.
Thank you, thank you, thank you.
We hope you enjoyed this episode of The Blend. Thank you for listening. We'll see you back next time.